Assalamualaikum guys, this is Amma from Yanzus, and today we will discuss about the side determination of clavicle. So here is the clavicle bone I have. So this is this round big is known as medial side, medial head, ठीक है, और जो and this flat end is known as lateral end, ठीक है. This is medial end. You can see it's a big rounded quadrilateral and it is flat on the other side. This end is known as lateral end. So basically clavicle is not straight. You see it is convex and concave. So how we can find that whether it is of right side or left side? So always remember this end is known as a medial end. Okay, so you can ask if I put it in this way, then it also turned out to be a medial end, but it is of left side. How we can identify it as a left side? There is a notch on the inferior aspect of the medial end. You see inferior aspect of medial end, here is a notch, and on the lateral end you see a roughened area, and also there is a subclavian groove. This is subclavian groove. When you can put your thumb here, you can feel it, a groove. This is subclavian groove and it lies on the inferior aspect. And the most major thing is the clavicle is convex in its medial 2/3 and concave forwards in its lateral 1/3. Mean it lies as a convex forward. You see this is convex forward in its medial 2/3 and concave forwards in its lateral 1/3. Okay, and the notch and the inferior surface on the lateral end, which is roughened area, lies inferiorly. So you can identify it as a left side. And why not it is of right side? Okay, I put it as here. The roughened area and the notch lies inferiorly as it is, but now medial side is not convex forward, it is concave forward. You see, and lateral end become convex forward, and this is wrong. So it is of left side. Hope so you get it.